recently we had finished taping a show, and we found someone on our staff with a little impromptu needed dental appointment. Bones, can you come over here, buddy? Bones is our lead stage manager, and as I looked at Bones, I noticed asymmetry in your face. So do you all notice something here? You all notice that there's asymmetry? So you have an indurated, really hardened area here. How long has it been there?
It's coming up on 2 days now.
I could tell that you had a developing tooth abscess. So because of that, Bones, because we love you, we had our favorite dentist, Dr. Bill Dorfman, come over.
Dr. Dorfman's here?
I was going to take you back to the procedure room and have him take a good look at this and see if we can't get this rectified.
Oh, thank you. That'd be
Are
great.
you up for it?
Yeah, yeah.
All right.
Let me take a look at you. Put your head back a sec.
I'm afraid
Oh, man, Bones.
Yeah.
All right, let me tell you what's going on, okay, before I even look in your mouth. Okay, you get an infection like that for one of two reasons, okay? I brought a little model to show you.
Okay, show it to camera.
Okay? Either, show it to camera. He's still directing. All right, Bones. Either the tooth is infected or the ligament around the tooth is infected. This can become something called cellulitis, where your whole face and neck can swell up so much you'll have a hard time breathing. Open for me. Yeah, Bones, you're gonna lose at least one tooth and maybe two. Can you see how mobile that is? I think it would be better if you just come over. It'll take me, seriously, 3 minutes to take those out. We'll put you on some antibiotics. Okay. You'll be a new man, Bones.
Okay, sounds good. Thanks,
All right.
You know, immediately after that, our stage manager, Bones, went to Dr. Dorfman's office for the procedure, and we tagged along.
You can see you have no bone at all here, and you see this big hole in there. So both of these molars definitely need to come out. Okay, open real wide, Bones. I'm just gonna push around your teeth a little bit and just kind of loosen up the gums around there. You're a good patient, my man. All right. You feel that, Bones? Mm-hmm. I am taking out the back molar. This one's out. And you can see all the plaque there. You see that? That's what was eating away the bone on the tooth. Now this tooth has a little bit more bone than the other one, but it's still a bad tooth. Okay, and I'm just gonna feel around this tooth just like I did on the back one. You okay? Mm-hmm. Okay, basically what we do is we just very gently turn the tooth. You can't rush these because if you do, the root breaks. There we go, here it comes. Here it comes. Voila. So this is the second molar. And now we're just gonna clean out the socket a little bit and we're good, all done. If Bones had let this go another few days, he probably would have ended up in the hospital with a condition called cellulitis, which actually can be life-threatening. I'm glad that we got those bad teeth out. I'm glad that he's on antibiotics and he's gonna heal up and be fine.
As I look at you at home, I'm always forever blessed to also have Bones right next to that camera. And may I take this moment to just commend you and thank you for all the excellent work that you do day in and day out on the show. We have someone on the phone, Bones, who wants to check in and see how you're doing. So, Dr. Dorfman, are you on the phone? Can you hear me?
I am. How are you, Travis? And more importantly, how's Bones?
Well, I can tell you, just looking at Bones, when I came into work this morning, that facial asymmetry, the induration, that hard area has gone down. He looks great. But let's ask Bones himself.
Thank you, Dr. Dorfman. Thanks a lot. I really appreciate it. I feel so much better.
Yeah. Wow, that was a big infection, Bones. You know, right now, the most important thing is for us to really just clean you up and make sure that you don't lose any more bones.
Okay.
And in addition to that, what we want to do is in about 4 months, you'll have enough bones filled in where we did those extractions, where we'll be able to place 2 implants in, and then we'll let those sit for about 4 months, harden in the bone, and at that time, you can come back in and we'll put 2 teeth on there on the implants, and you should be good as new, Bones.
Well, thank you. Appreciate that.
Hey, and Bill, before we let you go, It's not as though Bones wasn't getting regular dental checkups. He had been to the dentist the previous year. How quickly can a condition like this come on?
You know, when you get an infection like this, it can be really rapid. And in his case, it was because of bone loss. It can also be because of a root canal. So the takeaway here is the second you start to feel pain or swelling in your mouth, you need to be seen right away. But even more importantly than that is go to your dentist every 6 months, get checked up, and just make sure everything is healthy and stays the way it's supposed to stay.